Speaking with a very special guest. We have Dr. Nancy Mellin here from Northshore ENT here in Hammond. She is a board-certified board-certified in otolaryngology. Apologize for that, which is ENT, ear, nose, and throat. And she's also board-certified in sleep medicine, which is what we're going to be discussing today. Dr. Mellin, I know you see a lot of patients with sleep disorders, and that's something that negatively affects many people in their daily lives. But we want to focus today on talking about sleep disorders in children. I wanted to ask, how often do you feel like you're evaluating children for sleep disorders in your clinic?
Pretty much every day that I'm in the clinic, I'm dealing with children with sleep disorders and in particular obstructive sleep apnea. A lot of parents come in not realizing that their children may be having difficulty sleeping because of an ear, nose, and throat problem. And so sometimes these determinations are picked up at the time of the exam, and sometimes the parents actually come in with a specific complaint. But in general, I treat everybody, all ages, both genders, and which is one of the things I really like about my practice. So I do treat sleep disorders in everyone.
Sure, and I know, being there at the clinic with you throughout the week, it's great to see so many kids come in because it's great to feel like we're helping so many children in the community. So I really enjoy that about our clinic. What are some of the main sleep-related issues that you are finding in the children that are coming in today?
Probably the biggest problem that children come in with is snoring. And many parents think, well, my child snores and it's not a big deal. But snoring is actually an indicator of other problems that can be more serious in a child. These can be sleep apnea, where the child actually stops breathing, and sometimes this can be related to anatomy of the child, and it can also go into other parts of their life, particularly their school performance, their behavior, and so it has far-reaching consequences when the child does not sleep well.
Okay, so let's talk a little bit more about sleep apnea in children. What are some of the signs that, I'm now a parent, if I'm looking at my child and thinking that, hey, there's some snoring going on, what are some other things that maybe I can look for with sleep apnea or that would make me think sleep apnea in my child?
Well, when the child is snoring and they're making noise, you know that they're breathing.
Mm-hmm. Sure.
It's the quiet times that are really the times when the child is not breathing. Okay. And I have parents tell me not infrequently that they sleep with the child in the bed with them with their hand on the child's chest because they are monitoring the child's breathing all throughout the night, which means that the parent is not sleeping either, nobody's sleeping. A lot of these children left to their own devices, they don't know when they're sleeping, what they're doing. They're just trying to keep their airway open so that they can breathe. They sleep in all kinds of odd positions, their head thrown back, their mouth is open, and sometimes if you watch them breathing, you can actually see that the lower part of the neck will actually get sort of sucked in as the child is actually pulling for air.
Interesting. So, what would you say are some of the contributing factors to a child that is having sleep apnea? What are some of the things that you feel that contribute to them, whether it's a lifestyle thing or something with genetics, or just kind of what do you think contributes to a child having that?
Well, genetics definitely play a role. When the facial skeleton is differently configured than, say, in a normal person, whenever normal actually is, it can lead to tongue abnormalities, jaw abnormalities that can cause problems with obstructive sleep apnea. More commonly what I see is that the children will have very large tonsils and adenoids, and these tonsils are physically obstructing their airway. These children may also present with difficulty swallowing. A lot of times the patient's mother will tell me, well, the child won't eat meat. He'll chew it, he'll suck on it, but then he spits it out. He won't swallow it. Well, this is because they physically cannot swallow bulky foods. The child knows that they're going to choke on the food, and so they don't swallow it. It's not that they don't like the taste of it, it's just that they can't manage to get the food bolus down.
Gotcha. So earlier you had mentioned a little bit that if a child is potentially having an issue with sleep apnea, that it can affect them in school and it can affect their daily lives outside of their sleep. what are some of the things from a negative standpoint? What are some of the negative effects that sleep apnea can have on a child if left undiagnosed?
When adults get sleepy, we get tired. When children get sleepy, they do the exact opposite. They get wound up. Anybody who has kids has experienced this, and now you can't get them settled down. So this poor sleep on the part of children leads to hyperactivity. And a lot of these children will be diagnosed with ADD, ADHD, when in fact the problem is they're not getting good sleep. Now they're a behavior problem in the classroom because they're running all over, they're disrupting the classroom, they can't learn because they can't focus, so they don't do well in school, and then they have socialization issues because they're a behavior problem. So they get labeled in a negative way when really all they need is to get a good night's sleep.
Makes total sense. Makes total sense. Well, as we wrap things up here with our conversation about sleep apnea in children, can you, I guess, paint a picture to our parents that are out watching and listening today? Can you paint them a picture of what it is like as far as whenever they come to our clinic? We start out with, obviously, with an evaluation. Can you kind of take us through the general process of, we go through an evaluation and then the treatment options that we would have for sleep apnea, and just, you know, how that process would go so that they can maybe feel a little bit more comfortable about the process that we would do with their child?
Well, certainly any child or any patient for that matter who comes into the clinic for evaluation needs a thorough history and a thorough physical examination, in particular an examination of the head, neck, and upper airway. 90% of all children with sleep apnea will be cured by having their tonsils and their adenoids removed. Now, I have also found that some children have swollen tissue on the inside of the nose that I do not remove, but may require a cauterization for reduction of the size of that nasal tissue, because if I don't get a good airway and nasal airway in a child, I'm not going to solve the problem completely. And generally, you know, I hear all the time from moms, and dads for that matter as well, my child doesn't snore anymore, and they may even have gained weight by the time they come back following a tonsillectomy, because now they can eat, they don't have the tonsils obstructing the airway, and these kids are hungry. They have been hungry, but they just have not been able to eat as well as they would like. They gain weight, they grow, they sleep better, and moms and dads get a better night's sleep because they're not waiting with their hand on the child's chest to make sure that they're breathing.
Perfect, perfect. Well, listen, guys, thank you very much for taking the time to be with us today. And Dr. Mellin, thank you for chatting with us today about this very important topic. We certainly all want to do what's best for our children, and we know that a good night's sleep for them is very important, and for a good night's sleep for us. Certainly having an 8-month-old, I know exactly where that comes from. But if you suspect your child is having any type of sleep issues, or certainly anything with the ear, nose, and throat, certainly give us a call at North Shore ENT to set up an appointment to visit with Dr. Mellin. That telephone number is 985-542-9155. And we hope that everybody has a wonderful holiday season. And thank you, Dr. Mellin, again.
Well, and thank you.
Sure.